Hi everyone, it's me, Melanie, your IVF nurse, and today's video is going to be about inseminations or IUIs, and this can be with donor sperm or with your partner's sperm. Now, I did receive a request through YouTube specifically about this, so I'm just going to give a couple of tips. So the first thing being is that if you're using frozen donor sperm, you always want to make sure it's at your clinic by the time you are on day one or at the start of your cycle. So you don't want to have that extra stress of wondering if it's going to be there on time. You want to make sure that it's there and that, there are no issues. You've done all the necessary paperwork to indicate that you're going to be using that donor sample. So whether it's a specific consent form or signing off on the stim sheet that has your donor number so that the lab knows that when you're ready for insemination, that you've also done the double check where you're initialing the stimulation sheet or your cycle sheet that outlines your cycle from blood tests and ultrasounds and the doctor's order that you're ready for insemination. Now, if you're using your partner's sperm, the important thing for him is that when you have day one, that if he's going to be ejaculating, it's not every day. You want it to be every other day, and then as you near ovulation, he would stop. So you would check in with your nurses to see how far or close you are to possibly ovulating, depending on your follicle size and your hormone levels. And then you'd have that window of possibly 2 to 5 days prior to your insemination when the sample would be due for him to produce it. Now, other things to keep in mind, you can do things like acupuncture, which can help increase blood flow to the uterus. So if there's any concerns with the lining or even just for relaxation, acupuncture is great. Making sure that you're taking a prenatal vitamin is important. Any changes in your lifestyle need to be done within 3 months of when you start trying to conceive. So if you've changed your diet, if you're taking out alcohol or junk food or sugar or whatever you're doing, all of those things to really be effective need to take at least 3 months of that specific lifestyle to be really beneficial to your health and possibly help with the cycle itself. Now, the important thing to remember is that an insemination only really increases your chances of success or becoming pregnant about 8 to 10% above that of intercourse. So depending on your medical history, your age, all of those things will all play a role in terms of the success. One thing I do recommend is that if you have done 3 or 4 inseminations and you have not been successful, you do want to be making sure that you have an appointment for follow-up to discuss with your reproductive endocrinologist the next steps. And it doesn't necessarily mean going on to IVF, but it may mean introducing some medication. So whether it be oral tablets that you take to help produce a little bit more eggs at the time of ovulation, or even if it is a low dose gonadotropin insemination cycle. So increasing that number of follicles at the time of ovulation. The other thing is that once you're introducing any types of medications, this is one thing your RE would counsel you on, is that your cycle could be canceled. So if there's a risk of multiples, if you don't respond to the medications, so if you're a poor responder and say you would be better off without doing any of the medications because you're only going to produce 1 egg, then the doctor may just say, let's do a natural cycle because we're getting 1 egg every month anyway. Now, depending on your age as well, insemination may not be indicated for you. So that is something that you could discuss with your reproductive endocrinologist just to see if IUIs or TDIs are what would be suitable for your specific situation. Thanks for watching. Feel free to continue to email me at yourivfnurse@gmail.com with any questions or any topics you'd like for me to talk about. You can also check out my website, www.yourivfnurse.com. Follow me on Instagram at yourivfnurse. You can also subscribe to my YouTube channel or comment down below. Thanks for watching.